Hi, I'm Davie and I'm Officer for Health Promotion at the Royal College of Paediatrics. And I was going to talk to you today about the RCPCH Progress curriculum and what it means for training in health promotion and health improvement for paediatrics. Health doesn't begin and end at the hospital doors, and I think we can forget that when we're head down at the coalface. There are certain people who just keep coming back and certain groups that are particularly likely to become unwell. So it's really important to understand why that is, because if we can intervene, then perhaps we should to do some more preventative work. Of course, there are lifestyle issues involved, but then there's wider issues around poverty, around pollution, around cultural issues and social issues, all of which impact on what is coming through the door into the paediatric department. Of course, then you need to have the skills to be able to engage families to affect change, but also to understand why it's hard to affect change, why it's hard to live the lives that they're living, and also to just understand how it is that they've made some of the choices that they've made. I think that makes you a better doctor. It makes you certainly a less patronising one, and it will ultimately make it easier for you to keep your motivation in paediatrics to really improve health, because actually that is what it's all about. And at level 3 of training, what we want you to do is to be able to engage in the wider health setting, to make a difference, to demonstrate that you're trying to make an impact in the broader health of the population you serve. That doesn't have to be a public health intervention. You don't have to do an immunisation thing or something with the health visitors. You can do it whenever your interest and passion is, but the point is to engage outside the hospital with the wider determinants of health. That seems to me to be an important thing to do. Now, people get worried about the illustrations in the RCPCH Progress, thinking, well, how am I going to do all of these things? The point is that you don't. The learning outcomes are key in the curriculum, and in the syllabus, the key capabilities are the ones that you need to get, and those are fairly generic deliberately because there are lots of different ways to get them. So the message is, yes, you're not going to get all of the illustrations, you're not going to expose yourself to everything that we've given as an example, because they are examples. What you need to do is to engage in your patient's wider world, to understand why they are where they are, and therefore to make yourself a better doctor. Ultimately, when you're a senior doctor, you will be engaging with the wider health environment, and you better get ready for it, because it's really complicated, but with training, you can really make a difference. Thank you very much.